For you?
I have a few concerns. Shall I just start?
Yeah, please.
So first, I'm concerned about the shape of my nose. I think the nasion is
Yeah.
a little too high. I have a dorsal hump. This part is
Totally
little broad.
deviated.
Yeah, and I saw a scan there. I mean, a while ago, and I was told that I have a DNS also.
Okay.
Also, this part I think is a little too further outwards. I would like to have that corrected.
Okay.
My tip is too droopy.
Okay.
It plunges down, especially when I smile. So I would like to have it lifted upwards.
Okay.
When I lift it using my finger, I think this part, the upper lip.
Show improves.
Show improves, but it becomes like a tent. So it's like a tension nose. So I don't want that, but I definitely want my tip to be. I have some reference photos. I will show you. First, I will just tell you all the concerns that I have. The other concern, I'm starting with the other concerns, is first there is a lot of sagging over here. I think my zygomatic projection is not very great, especially to the sides. My jaw is protruded, lower jaw especially is quite protruded. I would like to have it forward quite a lot. I mean, so I was Dr. Madhu was suggesting that a genioplasty might be.
Sorry?
Dr. Madhumita, I talked to her earlier, and she was suggesting that a genioplasty might be a better idea.
Okay.
But I want something more extensive than a genioplasty. Also, the alignment of my teeth is not very great. The upper arc is very, so it's not in a single plane. So the posteriors are a little upwards and the anteriors are downwards.
So basically you want me to take care of both your jaws and also the chin, cheek, nose, all of it.
Yeah.
Okay. So I'll go one by one. First is your overall facial structure. If you see, what is the main issue is. So for a guy, you're lacking the width in the face. Your face is too narrow and long. So what we have to do, yes, you need genioplasty, all of that is required. But the basic thing is you increase the width of your face to make it look more proportional, more harmonious, more masculine.
Right.
So which means we have to augment here and augment here. Both. Only then will you have a broader angle and a broader this thing. That's the first thing that has to be done in your overall face. Now the next thing is the chin, because the chin is retruded and it's narrow, so we widen it again. We widen it, we increase the projection. Right. That's done with a genioplasty. We can do that. So that's the second thing. And with regards to your nose, you have mentioned all those you said, that's fine. All of that we can take care. It's starting too high like a Greek nose, tip is droopy, it's bent, it's deviated, it's broad, like almost every aspect of the nose has to be altered. Right. And then the good thing is you've got good skin, which is very thin. Okay. So you'll get a very good result.
Sharp tip. Right.
Yeah, you get a sharp tip, you get a nose that's proportional, right. And because there is excess, also I may not need rib. Okay. So that's also a good thing. I don't need to harvest rib. Mostly, I've said plus or minus, but maybe you will not need it. Okay. That's the first thing. And with regards to the augmentation, unfortunately, so you'll have to go for some foreign material to augment the chin, because I won't be able to, not the chin, the malar bone and the angle. I won't be able to put any natural osteotomy because it's very narrow for you, or there's no other way of doing it for you. So I'll have to get a peak or a foreign material and fix
peak
it.
As in?
It's a material. It's called. It's like a acrylic. It's like a polyethylene material.
But you're saying you'll have to put some foreign material between the bones?
No, outside the bone, like an onlay. Will be attached with screws to increase the width. That's the only way we can do so much of an improvement for you. To increase the width of the chin, the angle.
What is the so when we do a BSSO.
No, we can't do BSSO for you.
No?
No.
What
It will not increase the width.
So the segments containing the image.
And
what
you
if we
can't-
rotate it?
No, we can't do BSSO for you because your bite is fine. I've checked your scan. You can't do BSSO. You'll not get the result.
But if we do a biomax surgery, a rotational one, and
Whatever we do, width will not happen. This
can I show you?
transverse width will not increase.
Let me show you something. So this segment, what if we just widen it a little and put some material, I mean autogenous?
I can do that, but what will happen is then it will widen here. But we need it to widen there. If you widen it here, it won't look very nice. The sagittal split, so it will come here.
Okay.
So if I put a material here, this will widen up here. It won't look nice. If you have width on the body, it's not going to look as nice.
What if we just rotate it outwards? Like in this case, he has, I think, rotated it outwards. This surgeon.
No. See,
This part,
it's nice to do these kind of software gimmicks. It's not practically doable. Certain things, like you cannot widen it like this without widening it here. So you will finally land up with a face that will not look that nice. It's wide everywhere. What I'm saying is I'm only going to increase this area which will look nicer, like models and actors. If you do like this, everything will be wide. From here to here it will be wide. Oh, look nice.
but then you can, I mean, blur it out or the excess one out.
No, then you have to wait for 6 months or 9 months and then burr it out. 2 surgeries. Because first time I can't burr and cut. The moment you do the sagittal split and open it up, then we can't burr. And this and all you don't need to do. This
No,
you don't worry.
I
Genioplasty
was
I'll
just-
manage without that. I don't need to
just
do like this.
wanted, this part.
So what they have done is, see, they have made an osteotomy in the center. Here.
The split, the mid split, I don't want a mid split. So
If I have had patients who have undergone some procedures like this and I'm doing revision jaw surgeries for them.
okay.
It's not worth the risk for doing. You know how many osteotomies they planned for you here? 1, 2, 3, 4, 5, 6 osteotomies.
If we just forget about the mid split segment.
And after 6 osteotomies, it will not look good. So the idea is we do as minimalistic procedure or as less invasive, as less risky and get better results.
Okay.
Because you're already handsome. I don't want to do these kind of procedures for you. If you had a major accident and some other reasons, then we can think of such issues, such planning. Hello? Ama. Elanir venu.
I really don't want any implants or any.
Then, if you do not want an implant, then the sagittal augmentation will not be possible like that. We can do another augmentation of the lower border. I can switch the lower border out. I've done for a patient here right now, but it won't be. But I can't do on the upper jaw.
I heard you say
Upper jaw, I can't do that.
surgery, that in a LAFO one you can.
But I'm not planning lipo1 for you.
Can we?
No,
I mean, see if I have
the
seen
jaws are
procedures-
fine.
It's retruded. I mean, lower jaw is quite.
Yeah,
retruded.
lower jaw is.
So if we do an anti-clockwise rotation over the jaw,
But you will not be able to increase the width on your jaw so much. We can increase the projection with lipo1. If I have to increase the projection width here, it's not going to work like that. I have to put an onlay. And only increasing the width here and not increasing the width here will make your face even look worse. This intergonial distance should be less than intermalar distance.
Right.
So your intermalar distance is very poor. How do I augment it? I anyway need foreign material there.
even with the LAFO one, you won't be able to
No.
do something like that?
No,
So how much can be done with the LAFO one?
nothing. See, they have not even touched your malar bones.
This is not mine. So this is a result
I'm just
that
saying.
somebody.
Yeah, I know, but I'm just saying.
So, so what do you do to increase with the LAFO one? If you want to increase the bizygomatic width with the LAFO one, What do you
With the
recommend?
litho one, we can't do. We have to do a quadrangular litho one, but it's not possible for you. You're not a candidate for that. We can't increase the width. We can increase the projection in the anterior posterior dimension.
Okay.
Of litho one, we can't increase the width of the face. You're talking about increasing your width,
Right.
not the projection. Projection I can do with litho one. Width you cannot do with litho
Can
one.
you not push these
No.
parts out?
Then you have to do zygomatic osteotomies.
Okay.
Malar augmentation, osteotomies, not advisable. The role here is to suggest procedures that augment your facial aesthetics, that are reliable, that are safe, that are not crazy, that don't put you in some risk. That's my duty. I cannot do something just because you want it, right? It doesn't work like that. Because you won't know correctly what are the involved. There are so many nerves, so many anatomical issues here. And it's not that we don't do, because I'm craniofacially trained, so I do a lot of things, but there are procedures that you do not do for certain patients. So that is something, it comes out of your expertise, your experience, and I can't trade that just because the patient wants it, because this is against the ethics of patient satisfaction or patient benefit. This will be counterproductive for you. So I can't do that.
So what do you suggest?
So we can't do, see, I'll tell you what, I'll give you an example. For this cheek augmentation, I've had models, even abroad, they come to me, it's a daycare procedure. I augment the cheek, they go back home. After 3 months, the video shoot is over, they say, doctor, remove it now. I haven't done that. So it's not a very difficult procedure, not a big procedure. You understood? So it's better to go for something that's safer, that is not having many side effects. Now the osteotomies that we are talking on the lower jaw are all predictable, safe, nothing to worry for you. But when it comes to doing increasing the width, we don't have a solution like that. So unfortunately, we have to resort to a foreign material. Sometimes that's no other option. Or you don't do it. If you want it, then this is the best option. See, I am a totally anti-foreign material guy. I don't like to use. Even for my noses, I don't use. I harvest rib. Even if I need a centimeter, I harvest the rib. Imagine that. Centimeter, I harvest the rib. So I personally don't like to use any other material. But sometimes there's no other option. And we have good material also. When the correct need is there, then there's no other way of doing it. Or you don't do that procedure. We can't do another, some alternatives, not worth the risk. I won't do that.
So if we don't touch the malar bones and we do a rotational valve job, increasing the segments over here slightly, and I plan on doing the burring later on. So can we do that?
So
we at least make sure that
see, first of all, if you want to do that, we can't do your nose at the same time. So you have to come again to the nose, because your nose needs a lot of work. If I do a bi-jaw, your nose can't do, I can't do a full nose job with a bi-jaw in your case. And then secondly, you don't need a bi-jaw. We can look much better without a bi-jaw. You're not a bi-jaw candidate. So bi-jaws are major surgeries. I do a lot of them, but it's only for persons for whom there's no other option. You don't need a bi-jaw. You just can do a genioplasty, augmentation, rhinoplasty, and you look like really good. Because when you're smiling also, your upper teeth are visible. There's no issues. You're not having any sleep apnea. You're not having any other reason for us to do a bi-jaw. So bi-jaws,
I feel that even if we increase the projection of the chin, even to a good extent, it still might look receded.
it won't look receded.
Can I show you a few pictures and
But it won't look receded. I know. I'm seeing your scans, right?
so I'll show you. Not receded exactly, but it looks sometimes off when teeth are back. So I saw this. This is probably your question, but what I'm trying to explain is, if my teeth are a little back, it might not look. Definitely she's looking better than before, but
this she, I think, is a bi-jaw we did.
is she?
Yeah, I think we did a bi-jaw for her.
I don't know.
I'm not sure what we've done for her.
It looks like a chin has changed. So
The lip also has changed. The height has increased.
maybe less
So could be a bijaw.
But I don't wanna, I mean, end up in a position where my chin is good, but overall the
But you can't do a bijaw and bring. There's no space for you. How can you do a sag? You have to do sag for 1 or 2 mm. There's no gap. Where will
no
you
gap
bring?
as in
Where will you bring the lower jaw forward? Your bite will get wrecked.
if we just rotate the upper and lower jaw together,
So chin won't come forward.
right?
Then you have to bring both the upper and lower jaw forward. Then it's a bijaw.
Yeah, I mean, when we move them together, in a way that upper jaw moves less than the lower jaw, and we do this kind of motion where the lower jaw comes forward.
But then your face will look even longer. Anti-clockwise movement, what you're doing, your face is already thin. Already it is less wide. If you make like that, your face will look even longer and look horrible, worse.
So when I move my lower jaw forward like this,
See, listen to me. Your ideas are not correct.
okay,
I don't know, what is your profession?
I'm a software engineer.
Yeah, so you please stick to your software job only.
Okay.
This let me handle. Because I cannot explain what all these details and how long will I talk to you like this? What you're telling is not correct.
Okay.
You listen to me and go ahead like that, or don't do anything about your face. Just do your software work. Don't screw up. It's not worth it. If you rotate your jaw you want me to do like this, okay, like this you want me to do, right? If I do like this will rotate, correct? Your chin will come forward. Your face will be another 1 centimeter longer. Who will address that later on? Your face will become like a horse, even long. It's already narrow.
Okay.
And this movement you're suggesting is going to make the face even longer.
Okay.
So why would you do that? It's not correct for you. If your face was short, rounded, and then all this is fine, not for you. Your face is already over proportioned. We cannot do this. You should not do these kind of movements. So I don't know who you have met and what people have suggested, but the face has to be looked as a whole.
Right.
Not just the chin. Now, if you do for the chin, if I do the way you're doing, your face will look longer. It will become this much. Then, already we are trying to increase the proportion between your facial height and facial width, right?
Right.
If you increase the height and don't touch the width, it's going to look worse. So how will that solve the problem? I'll make it worse.
Okay.
And your scans, we cannot do such stuff with you. Don't need it at all, and it's going to make you look worse. Got a nice angle. You don't need to touch anything.
It's just like merging with my neck.
Simple thing you can do. Rhinoplasty you need. I already told you that we can give you good result. Only genioplasty. Simple. 2 options. It's much better than all the things that you're suggesting. It's going to look worse.
Not going to do anything about that.
If you don't want foreign material, don't bother about it. Just leave it.
Can you not do an osseous?
But I can increase the width here. I can't increase the width on the upper jaw. Then it won't look good. We have to increase the width.
Compared to the width that I have right now over here, it's still quite small. narrow,
No. See, if you increase the width on the gonium, then we have to increase the width on the malar region.
Even if we increase a little bit.
Yes, otherwise it's going to look bad. But this width I can increase but I cannot increase the upper width without a foreign material. And then don't do any width. Don't bother the width first.
I'm quite concerned about the width actually.
Then this is the only option.
Okay.
Upper we cannot increase
Can
the
it
width.
merge with the bone?
No, we have to go on.
Are there any materials that eventually?
No, not that we can use it in that area.
Are there like any other alternatives? I really want to have something done to both my angle and the pragmatic bones, but I'm really concerned about having foreign materials forever.
In that case, I'll have to do a zygomatic osteotomy only. That we can do separately.
Separate, can we not?
I can't. I don't think I'll be able to combine everything in one go.
Please, can you please?
Because we have to do too many things for you already. We can come separately for that.
I would request you.
So we can do an osteotomy to increase this width.
Got it.
Chin I can do.
Right.
Then we can do the nose. That itself will take me 5 hours first of all.
Okay.
Again, this will take another 2-3 hours. So it's not going to be possible in one go. First reason.
It would be very difficult for me to come back again and get another surgery done. I was hoping to get everything sorted in one go. I would really appreciate it if you.
அவங்கள பார்த்துட்டு போக சொல்லுங்க சாராவை ஏதோ பண்ண சொல்லணும் பல்லு எடுத்துன்னு சொன்னாங்க இது ஒன்றும் வாங்காதீங்க மருந்து மட்டும் வாங்கிட்டு அனுப்பி விட்ருங்க
I'm okay if I need to wait for a day or two.
No. Not a day or two, then you have to wait for a week. I'll have to take a model again.
Before the surgery? Yeah, sure. So you want the surgery to happen after a week? Is it?
No, I want a model like this made.
Okay, cool. Let's have it done. Sure.
We'll have a model like this made.
For a single surgery, doctor, please.
I'll try my best. In case not possible, then what we have to do is one day we do the zygomatic osteotomy, the genioplasty, and the bilateral angle osteotomy. Not osteoplasty, osteotomy to bring it wide. One day. Then after a break of 3 or 4 or 5 days, some days, then we do the nose.
Sure, that is fine.
Something like that we have to do. On the same day, it's not going to happen because it's going to be too long.
Sure.
Because to do this, I need bone graft.
Okay.
I have to take some bone graft. That will be extra procedure. I have to take from the iliac crest.
From the rib or?
No, iliac crest.
Okay.
And then if I have to do the nose, I might need ribs. So it's going to be too much of a procedure for me to do.
Okay.
So let's just keep it on hold now.
I would still say if we can do it in one day, let's try. But I'm open to this idea that you're suggesting that.
Let's first take this model. Dicom வேணும் அந்த எழுத்து நமது கூப்பிடுங்க.
So when can we?
1 week's time, 5 days time I'll need because we're going to get this fabricated.
Okay, 1 week's time before we
start. Yeah.
Okay.
Another DICOM. Ask the CT scan, get it done. So see what I'm going to do is I will show you and then if you're okay we will proceed. That's why I'm getting this done. I will make a model like this.
Okay.
The current scan. I will cut here and I will show you where I'm going to put the graft and where I'm going to put the osteotomy on the lower jaw. This guy that we did that widening of the angle recently, that magician, we have a post-op scan for him?
No, he's not gone.
Has he come today?
He should be coming. She hasn't come yet.
Just see if he's come today. If he comes today, just take a scan for me. I have a patient right now whom I have done that, but not the malar.
Okay.
Just the angle. I widened it with osteotomy.
It can. It looks pretty natural, right?
Yeah. He's very happy. He looks nice. He's only 7 or 8 days after surgery.
Okay.
But we didn't do too many procedures. So that's the thing, we need to also keep the thing in. To be honest with you, the benefit ratio for doing this kind of procedure that you want is not there. For 3 mm, how much we can do? 3-4 mm we can do. If it's an implant, it's faster, it's safer, nothing happens there in that area. I can still do, but it's like I do it for craniofacial patients, who have these issues in their bum or some, like there's a girl I'm planning now, she's an accident case, like those patients we do. For other patients we generally don't do these things
but
because
this is like predictable, right? So
but it's a major surgery for a small thing.
But eventually this will merge with my bone, right? So
Yeah, if you heal with the bone,
and,
you'll have a plate there, but it'll merge with the bone.
Yeah, that is what I'm after actually. That everything eventually sorts
So get his dicom and no before after, just one model. I will do the saw there on that itself. No before after. Okay?
Yes,
As it is just one. So 5 days time or something. What you have to do is, see, first of all, before we do that, let me write down now the procedures that we're going to do then. So I've written on. So 4 procedures are there. And we're probably going to do it in 2 stages, the gap of 4 or 5 days. That I'm not sure. That we'll plan once I get the model. And then for this, you can talk to my staff, and they'll tell you the downtime is going to be like a week to 10 days post surgery.
Both of them combined?
Yeah, whatever it is.
Okay.
Minimum 10 days. 1 week to 10 days it will take, because we're doing too many things.
So how long do I plan to stay here?
So that's what. So if we start after 5 days or a week, then which means that you will stay for another week after that, another 10 days after that.
Okay.
And you have to, we will call you for the surgery. You have to give your number, and we will get the scan done now for this fabrication.
Okay.
And you can talk to my staff. They will tell you the process to get this done. And once this is done, we will call you. Once it reaches our hand, that is. And then that might
So
take.
this is something that I need to take care of? Or?
No, we will take care of everything.
Okay.
But you will be in the loop so that you know it's ready.
Okay.
And also they will tell you the costings and time period that's required for this. And once it's ready, we'll call you for the surgery.
Can
But
you give
roughly
me a brief estimate of the
everything they will tell you, not brief, precise costing they will tell you.
Okay.
No brief,
And
exact
one thing,
costing.
Is there something, I mean, is my septum okay? Will you-
No, it's not okay, septum. I've written septoplasty. I've already seen your septum.
So
We need
is this something that I can get a claim?
only septum you can claim. Rest all nothing.
Yeah, I mean the septum part, right? So
Huh.
it will, I mean, so for example, if a surgery is happening and there are other costs associated, and so they'll reimburse the complete part for the septoplasty.
Don't
Right.
think so.
No?
Septoplastic part, that whatever
For
it is,
example, the OT charges and all of
that they might do. That I don't know. That they will give you the bill however we give. So I've written 4 major procedures. They will give you like that. That's all.
Okay.
That insurance part you'll have to clear with them.
Okay, but this, I mean, does require functional.
Functional thing is there. See that?
Yeah, it's quite.
That is there. But that is 15% of your whole surgery we are doing. So you are looking at such a small reimbursement, ideally.
No problem, no worries.
We are doing so many other things, this becomes 15% only, or maybe 10%. Very insignificant part. But we'll still give you the bill for everything, and you can try to get your reimbursement done.
So
Only
you
that part is functional, unfortunately. Everything else is totally cosmetic.
So after surgery, after a big healing period, can I get into some contact sports or
6 weeks later.
everything is fine? So
Everything
if
will
I
heal.
Get punched in the face, it might
6 weeks you can do everything, 6 to 8 weeks.
hit.
Okay.
So do I need to stay for another 5 days?
You have to just stay for 1 more hour. They'll tell you all the details. You do like that. Then you can leave and come back again, or you can stay if you want. Whatever suits you.
Okay.
Okay.
Great.
Right.
Thank you so
And
much.
once the model comes and again discuss with you, we'll again have another consultation.
Okay.
And again I'll let you know what best I can do, and I will show you. Then we'll proceed. It's not that it's just accepted now and we're going to do the surgery, because I still want to see the model and I'll let you know. Okay.
Great.
You will scan it. Okay. See you.
Thank you so much.
Yeah, welcome.